Sandy is 29 years old and experiences bleeding between periods. The nurse marks which of the following on Sandy's medical chart? A. Metorrhagia. B. Menorrhagia. C. Menomtorrhagia. D. Polymenorrhea. E. Oligomenorrhea. The answer is A. Metorrhagia. Metorrhagia is bleeding between periods. Menorrhagia refers to excessively heavy periods. Oligomenorrhea refers to light, scattered periods, typically spaced by greater than 35 days. Polymenorrhea is used to describe short cycles of equal to or less than 21 days. Menomtorrhagia is used to describe periods that are heavier, sporadic, and more frequent than normal periods. A patient tells the nurse that she is practicing fertility awareness. The nurse tells the patient that the unsafe period can range from A. 2 days before and 1 day after ovulation. B. 7 days before and 7 days after ovulation. C. 2 days before and 2 days after ovulation. D. 1 day before and 1 day after ovulation. E. 1 day before and 2 days after ovulation. The answer is B. 7 days before and 7 days after ovulation. According to the family planning method of contraception, the period in which conception can occur and one should refrain from intercourse is up to 7 days before and 7 days after ovulation. Some references show that sperm can live for up to 5 to 7 days inside the female reproductive system. An unfertilized egg can live from between 12 to 24 hours. This greatly increases the window in which conception can occur. Which of the following is false regarding oral contraceptives? A. They may reduce the risk of uterine cancer. B. They may heighten the risk of depression. C. They may decrease the risk of breast cancer. D. They may increase the risk of developing a blood clot. E. They may decrease the severity of menstrual cramps. The answer is C. They may decrease the risk of breast cancer. Oral contraceptives may increase the risk of breast cancer, increase the risk of depression, and increase the risk of developing a blood clot, higher in women who smoke cigarettes. They can reduce the risk of uterine cancer and are frequently used in women with primary dysmenorrhea. Primary dysmenorrhea refers to painful menstrual cycles without an underlying cause. A 51-year-old female arrives at her doctor's office because she has not had any periods for 12 months. The nurse should suspect A. Pelvic inflammatory disease. B. Endometriosis. C. Menopause. D. Polycystic ovarian syndrome. E. Pregnancy. The answer is C. Menopause. Amenorrhea is the complete absence of a period. There are many different causes for amenorrhea. One of the most frequent causes of amenorrhea for women in the 5th decade of life is menopause. Menopause is the most likely cause of amenorrhea in this particular patient because she has not been experiencing periods for 12 months and is 51 years old. While pregnancy is possible, the nurse would suspect menopause first. Pelvic inflammatory disease, PID, is a pelvic infection usually resulting in severe pain. Endometriosis is a condition in which uterine tissue inappropriately grows in areas such as the rectum or ovary, also typically causing severe pain. Polycystic ovarian syndrome is a condition causing hormone imbalance. It can cause amenorrhea. Jody is a 40-year-old woman seeking care for dysmenorrhea for the first time. Which would not be considered an appropriate treatment? A. Oxycodone, acetaminophen. B. Naproxen. C. Oral contraceptives. D. Ibuprofen. E. Lifestyle modifications. The answer is A. Oxycodone, acetaminophen. There are many different ways to treat painful periods, dysmenorrhea. Ibuprofen and naproxen are anti-inflammatory agents that do not require a prescription and can be very effective. They have relatively few side effects. Lifestyle modification, such as exercise, is another good alternative. The use of oral contraceptives are also frequently used to give women lighter and milder periods. Percocet is not generally used because it is an opioid analgesic and not recommended for long-term use because they carry potential for addiction. Which of the following is false regarding the respiratory system of pregnant women? A. There is increased metabolic demand for oxygen from the body. B. The rib cage becomes slightly more compact. C. Total lung capacity decreases. D. Oxygen consumption is increased. E. The diaphragm elevates. The answer is B. The rib cage becomes slightly more compact. In pregnancy, the ribs start to flare, expand slightly, as the pressure from the growing fetus moves the diaphragm upwards. Many women experience this during the third trimester as the baby is at its largest. The flaring of the ribs is assisted by maternal hormones that enable more flexibility throughout the body. Which of the following reasons does not indicate the need to induce labor? A. Post-maturity. B. Diabetes. C. Fetal jeopardy. D. Fetal macrosomia. E. Gestational hypertension. The answer is D. Fetal macrosomia. Induction of labor may occur for various indications: diabetes, post-maturity, hypertensive disorders or pregnancy, fetal jeopardy, or logistical factors including distance from qualified hospital or a rate of rapid birth. Induction of labor may only occur if the mother does not have cephalopelvic disproportion, CPD, the fetus has a vertex presentation with an engaged head, and the mother has a ripened cervix or is prepared to be ripened. Fetal macrosomia is a concerning condition and may require intervention, but is typically not resolved by inducing labor. With fetal macrosomia, a cesarean section may be considered instead of vaginal delivery, due to the potential risks of delivering a large infant vaginally. What is the most common form of female reproductive tumor? A. Choriocarcinoma. B. Uterine leiomyoma. C. Yolk sac tumor. D. Endometrial adenocarcinoma. The answer is B. Uterine leiomyoma. The most common tumor of the female reproductive tract by far is uterine leiomyoma, also known as a uterine fibroid. Uterine fibroids are benign smooth muscle tumors that grow into the myometrium. They can often cause pain in the lower back or pain during penetration, dysmenorrhea, and menorrhagia. Sudden onset of severe abdominal pain with a unilateral adnexal mass would most likely be which of the following conditions? A. Polycystic ovarian syndrome. B. Teratoma. C. Pelvic inflammatory disease. D. Ovarian torsion. The answer is D. Ovarian torsion. While any of the conditions listed can cause abdominal or pelvic pain, The most likely cause of severe pain of sudden onset is ovarian torsion. This is an emergency condition which can result in loss of the affected ovary if not treated within 4 hours. Clear cell adenocarcinoma of the vagina is strongly linked to pre-birth exposure to what medication? A. Acetaminophen. B. Diethylstilbestrol, DES. C. Clomiphene. D. Thalidomide. The answer is B. Diethylstilbestrol, DES. Diethylstilbestrol, a medication used from 1940 to 1971 to reduce the risk of miscarriage, resulted in the later development of clear cell adenocarcinoma in many of the unborn children of these pregnancies. A patient enters the labor and delivery unit. She is having a singleton birth and the baby is showing minimal variability on the fetal monitor. Interventions may include all but A. Giving the patient a 500 ml IV fluid bolus. B. Placing the patient flat on her back. C. Contacting the provider. D. Placing the patient on a non-rebreather mask. E. Suggesting that the patient walk with a portable monitor. The answer is B. Placing the patient flat on her back. Increasing fluid and oxygen administration may increase the overall oxygenation of the fetus and result in greater variability in heart rate. It is advisable to change the position of the patient, however, a supine position is not compatible with pregnancy. Contacting the provider is an acceptable intervention given concern for fetal well-being. What is the most common cause of mucopurulent cervicitis? A. Chlamydia trachomatis. B. Gonorrhea. C. Herpes simplex virus. D. Human papillomavirus. The answer is A. Chlamydia trachomatis. The most common cause of mucopurulent cervicitis is Chlamydia trachomatis, followed by gonorrhea. Human papillomavirus, while it is associated with increased risk of development of cervical cancer, does not cause mucopurulent cervicitis, nor does herpes simplex. Which of the following conditions can result in temporary masculinization of a pregnant woman which resolves after delivery? A. Placental ematase deficiency. B. Growth hormone deficiency. C. Closma. D. Polycystic ovarian syndrome. The answer is A. Placental ematase deficiency. Placental ematase deficiency is a condition that prevents testosterone from being aromatized into estrogen during pregnancy. This results in a temporary masculinization of the mother that does not continue past delivery. Neither closma nor growth hormone deficiency result in masculinization, and masculinizing symptoms of polycystic ovarian syndrome often improve during pregnancy, rather than getting worse. Which of the following conditions presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy? A. Bacterial vaginosis. B. Lichen sclerosus. C. Contact vulvitis. D. Herpes simplex. The answer is B. Lichen sclerosus. Lichen sclerosus is a condition that presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy. It is most common in postmenopausal women, though it does occur on occasion in younger women and girls. While all of the other conditions listed can cause pruritus and pain, None of them are associated with frank atrophy. All of the following are part of the Amsel criteria for bacterial vaginosis except A. Thin gray or white vaginal discharge. B. Vaginal pH greater than 4.5. C. A positive whiff test on addition of potassium hydroxide to the vaginal discharge. D. All of these are part of the Amsel criteria for bacterial vaginosis. The answer is D. All of these are part of the Amsel criteria for bacterial vaginosis. The Amsel criteria for bacterial vaginosis are as follows: clue cells seen on microscopic examination, a positive whiff test on addition of potassium hydroxide to the vaginal discharge, a vaginal pH greater than 4.5, and thin gray or white vaginal discharge. Which of the following is not a risk factor for uterine leiomyoma? A. Smoking. B. Red meat consumption. C. Obesity. D. Family history. The answer is A. Smoking. The main risk factors for uterine leiomyoma are family history, obesity, and red meat consumption. Smoking is not a risk factor. Up to 90% of cases of pelvic inflammatory disease have what etiology? A. Human papillomavirus only. B. Neisseria gonorrhea E only. C. Neisseria gonorrhea E and chlamydia trachomatis. D. Chlamydia trachomatis only. The answer is C. Neisseria gonorrhea E and chlamydia trachomatis. 75 to 90% of cases of pelvic inflammatory disease are caused by Neisseria gonorrhea E and or chlamydia trachomatis infections. This condition, typified by adhesion formation in the uterus and fallopian tubes, can result in serious issues such as infertility, ectopic pregnancy, or reproductive cancer. Which of the following is part of the diagnostic criteria for pelvic inflammatory disease, PID? A. Fever. B. Leukocytosis. C. Elevated erythrocyte sedimentation rate, ESR. D. All of these. The answer is D. All of these. The criteria for diagnosis of PID are as follows: fever, cervical motion tenderness, abdominal pain, leukocytosis, elevated ESR, and purulent cervical discharge. What would be the primary concern in the case of rubella infection during pregnancy? A. Maternal ocular damage. B. Gestational diabetes. C. Birth defects. D. Maternal death. The answer is C. Birth defects. The primary risk in rubella infection during pregnancy is to the fetus. The rubella virus is able to cross the placenta, and acts as a teratogen by inducing apoptosis in fetal cells. This is termed congenital rubella syndrome. Birth defects can include deafness, ocular damage, cataracts, congenital heart defects, hepatomegaly, and developmental disability or delays. At what time during gestation is a fetus most susceptible to congenital rubella syndrome? A. The first 12 weeks after conception. B. Week 12 to 20. C. Week 20-30. D. Week 30 to 40. The answer is A. The first 12 weeks after conception. Infants who are exposed to rubella during weeks 0-12 of gestation have a 51% chance of developing congenital rubella syndrome. If the fetus is exposed to the virus between 12 and 26 weeks, the incidence of defects drops to 23%. Congenital rubella syndrome is rare in infants whose mothers were initially exposed to the virus after 26 weeks of gestation. Interestingly, the fetus is more likely to have birth defects if the mother contracted rubella before conception. Infants whose mothers contracted the virus 0 to 4 weeks before conception have as much as 43% incidence of congenital rubella syndrome, due to its long incubation period. Which of the following is the definition of gestational hypertension? A. Blood pressure over 160/95 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. C. Blood pressure over 130/85 mm of mercury or rise of more than 35 mm of mercury systolic or 20 mm of mercury diastolic over baseline. D. Blood pressure over 140/90 mm of mercury or rise of more than 40 mm of mercury systolic or 25 mm of mercury diastolic over baseline. The answer is B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. Gestational hypertension is defined as a blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. It generally develops after week 20 of pregnancy and returns to normal after delivery. Which of the following is not a part of the triad of gestational hypertension? A. Proteinuria. B. High blood pressure. C. Edema. D. Headache. The answer is D. Headache. The classic triad of gestational hypertension is high blood pressure, proteinuria, and edema. New onset headaches during a pregnancy that includes gestational hypertension may be a sign of a more severe condition, such as preeclampsia. At what point in a pregnancy is preeclampsia most likely to develop? A. 0 to 12 weeks. B. 12 to 24 weeks. C. 20 to 32 weeks. D. After 32 weeks. The answer is D. After 32 weeks. Preeclampsia occurs more frequently in the last 8 weeks of pregnancy. Occurrence at an earlier gestational age is associated with increased severity and poorer outcomes for both mother and fetus. Which of the following increases risk of ectopic pregnancy? A. History of pelvic inflammatory disease. B. Endometriosis. C. Post-tubal ligation. D. All of these are correct. The answer is D. All of these are correct. Ectopic pregnancy is a serious condition in which an embryo implants in tissue outside the uterus. Risk factors include pelvic inflammatory disease, tubal ligation, endometriosis, tobacco smoking, history of infertility, and the use of assisted reproductive technology. Which of the following is a risk factor for development of toxoplasmosis in pregnancy? A. Undercooked meat. B. Contaminated water. C. Exposure to cat feces, often via a litter box. D. All of these. The answer is D. All of these. Toxoplasmosis is a parasitic infection that is capable of crossing the placenta. It can cause birth defects such as hearing loss, learning disorders, and visual impairment. Toxoplasmosis infection is primarily a concern only in individuals who have never been exposed to the parasite before pregnancy, as most people develop immunity to infection 6 to 9 months after their first exposure, often through contact with cat feces in litter boxes or soil. The main routes of toxoplasmosis infection in pregnant women are exposure to cat feces, water contamination, consumption of undercooked meats, and blood transfusion.